Hi, everyone. Welcome and thank you for attending today's webinar with Fullscript and Emla Tubo. I'm Sarah Kunzer from Fullscript, and I'm so glad that you have joined us today. Before we get into the presentation, I wanted to go through a little bit of housekeeping. So first, I just wanted to remind everyone that this is being recorded and will be sent to each of you who registered. So if you have to leave early or you just want to watch it again, you will have access directly from your inbox. The recording will also live on Fullscript's website, where you can access all of our past and upcoming webinars and workshops as well. Throughout the webinar, if you have any questions, please add them to the Q&A box, and we will get to them during our live Q&A portion at the end. And there is also a copy of the slides in the handout section if you want to take notes or follow along there. And with that being said, I'm going to pass it over to Emla to take it away, and I will rejoin you at the end.
Well, thank you, Sarah. Thank you very much for having me. I am honored to be hanging out with everybody today during this time of the year, which we know is a very busy one for pharmacists and all healthcare professionals in general. And I'm just going to skip through that real quick. And so today, during the time that we're spending together, we're going to talk about immune support as we change seasons. As we're changing seasons, it's always a very hectic time for the student, for the teacher, for the mom, for all the healthcare professionals. And I am yet to meet somebody who wants to jeopardize their health. Everybody wants to be the most active and the most productive during this period. As pharmacists, flu shots get shipped around the end of August. And we start as soon as they come in. And as soon as we start dispensing more antibiotics. All the upper respiratory tract infections, they line up, and the supplement questions start rolling. I like to start with asking what your biggest challenge is when recommending supplements to your patients. If you are able to just type in, just give me an idea if you face the same challenges that I face, or let's see what are some of the problems that you face when you recommend supplements to your patients, especially during this period. Because nothing comes without challenge. Patients come in with difficult questions, and we're there trying to put workflow together with supplement recommendation, with vaccines. Do we have any responses, Sarah?
It looks like the most common response is cost, patient finances, and people don't want to pay the price for supplements.
Okay, I'm going to take the price because cost and price in there, and then patients don't want to pay the price of it. Here's what I have to say about that. And this is, my personal take. And I found that this has worked for me a lot at my practice. When I'm recommending a supplement to a patient, I look at it as 50-50. I separate and say my recommendation is going to be 50% of my work, and the patient actually purchasing the supplement is the other 50%. I am 100% responsible for the 50%. The other 50% is on the patient's side. I'm going to make my solid recommendation, and I use myself as an example. I use my family as an example. I use my staff as an example, and I leave it at that. No additional pressure like a car salesman, as they would say, but I give the data, I give the information, and I say, this is what I do for myself. I'm going to be addressing this a little bit later during the presentation, but I'll take an example and I talk about the children and I say, this is what I do. I have a 15-year-old and this is what I give him. Very solid recommendation coming from a mom. And when I say it with my mom face and my mom eyes and ears, and with concern, knowing that, as a pharmacist, where I practice at my pharmacy, I take care of all the children that come to the pharmacy, but the children that come to this pharmacy that are mine, I love my children more than every other child that comes to this pharmacy. And if I'm able to give this to my child, this is really my solid recommendation, and this is what I will do. And No bothers beyond that. You will say the first time, the second time, or the third time, eventually the patient will come around and get the supplement. And 74% of our patients are taking supplements. This is 74% of patients who are walking through the doors of your pharmacy. This is 74% of patients who are taking the recommendations from friends. And this is 74% of patients, they are ending up buying this on TikTok, they're buying this on Instagram, they're buying this on Amazon. So a lot of times they would say they don't want it, probably because prevention is really hard to do. Because if you do prevention right, you don't see anything. You don't see an outcome. You don't see a physical outcome that you can touch immediately. So I like us as pharmacists to take away our strong attachment to the result, to an immediate result after recommendation. So give the solid facts, make your recommendation, leave it at that. Some patients will buy, some patients will not buy. Switch it around to vaccines. If I make a recommendation for somebody, I say, okay, hello, Mrs. A, you just turned 50. When you celebrate your 50th birthday, my recommendation is for you to get your shingles vaccine. Chances are that she might not get it that day. She might get it in the future. When she goes and her physician recommends it again, she might come back, or she might go home and her sister or aunt gets shingles and she goes, oh, that pharmacist had mentioned it, and she'll come back, or she'll see an ad for it later on. So, but it's a compounding factor. My recommendation that day added to the day that she will eventually get that vaccine. And that's kind of how I address the hesitancy of, buying at that time or making that purchase. I'm going to go on to the next one. I kind of took some time there for that. But as we look at our immune systems and we think about our innate immune system, innate immune response and our adaptive immune response, we're looking at the first line of response, non-specific, generalized for innate. And then for the adaptive, we're looking at the acquired or the pathogen-specific ones, which we have learned, our body has learned how to respond. But what happens is that as we add the stress of being, of chronically being stressed, more time without sleep and other barriers coming down like alcohol and comorbidities, those make our immune system more susceptible to all these upper respiratory tract infections. And during this time when we're instead trying to increase productivity. As we go forward, with the recommendations that we make, we're looking at it from this slide shows like the different ways that I look at it from. It's typically, in my mind, it's a win-win-win, because the patient is getting the recommendation from the sound clinical knowledge that I'm coming with as a pharmacist. And the patient is going to purchase a supplement if they do that day, or they are going to have that knowledge so that in the future, when they need to purchase that supplement, they will be coming back to the pharmacy, or they'll be purchasing that supplement on my website. And the revenue opportunity that is bringing to my team. Prior to going to the patient, I want to take it one step back and say, these patients whom we often look at as maybe not willing to pay the full price on that day, or maybe not willing to make that purchase at that day, we all have a full cabinet at home of supplements, prescriptions, and everything. We have this full cabinet, but we're still not feeling well. The foundational way to look at it is to start with taking the patient as they are and asking a question. If you were to change one thing about your health, what would it be? That's usually a question that I usually lead with. And it empowers the patient for me. It empowers the patient to be able to take charge and say, I'm going to stop, I'm going to think, and I'm going to answer this question that this pharmacist gave me. So thinking about what I can change. Sometimes that question directly doesn't go towards immune system, but eventually I'm able to link it to the immune system. I'm able to come back there and make a recommendation that will be able to help the patient to be able to get the supplements that they need at that time. And as we go ahead and personalize it for them. And when I personalize it, I always use their answer to the question that they initially asked. When I asked them, if you could change one thing about your health, what would it be? From where they answer, I take that and I lead to the next step. And I lead to the next step knowing that, Is this a patient that fills their prescriptions at my pharmacy? Can I glance at their profile? And when I glance at their profile, the first thing that I want to start with is I usually start with foundational supplements. And I'm looking at foundational supplements as supplements that, in my opinion, have the least drug interactions. And we're looking at vitamin C, we're looking at vitamin D, zinc, N-acetylcysteine, and quercetin. These are usually my go-to for foundational supplements. And these are included in the protocol on Fullscript. So if you're able to just be able to send a plan to them and pick out one of these supplements for them, or even combination products that have these supplements for their patients. So that way, this takes into account my general patient that is breastfeeding, because these supplements listed on this slide are safe for breastfeeding. They're also safe for pregnant women, and they're safe for patients that have autoimmune conditions. And those are typically our most difficult patients. And also the patients taking several medications, because with the reduced risk of drug interactions, we're usually safe throwing a vitamin C or vitamin D or zinc to any of these patients. And these will be, bioflavonoids, which, they could be getting quercetin, they'll be getting, from their food, and NAC, which gets converted to glutathione when it gets into the liver, gets converted to glutathione. To me, if you were to ask me to pick out one supplement on this list, which is my favorite, I'll pick NAC, because I consider it the grandmother of all antioxidants. NAC and C would be the strongest antioxidants on here, helping quercetin to do its job, and also reducing like the duration of colds, as well as the zinc. So, but I would go with these foundational supplements for drug interaction reasons, being with the fact that we are at the pharmacy. And then I would look further into the patient profile. And based on, some patients come in with a natural preference towards herbals. Some patients are already always prone to, taking more echinacea or elderberry, astragalus, and things like that. So I am usually a little bit more cautious with these herbals, because of the drug interactions that exist. So there could be some drug interactions which I would look up for the patients based on their medication history and based on their disease states. Not a whole lot, because with these being herbals, again, there are some drug interactions, but not very severe. But I would look at those and then make those recommendations as we go. And then there are combination products again that will have all of this. And I also looking at the foundational in the previous slide and looking at these ones, the herbals, I also look at pill burden. If you are looking at taking all of this separately, this just increases the pill burden, and then ends up, I look at it again, I say, the best supplement that a patient will take will be the one that they actually take. Because if they buy it and go keep it at home and don't take it, we're really not getting the good use out of it. So we're looking for combination supplements, we're looking for drug interactions, and also I would look at, once I've put together all the supplements and made recommendations to the patient, I'd ask them hesitations, and I would address hesitation individually. And that's my way of personalizing it. And when I do that, I take it back to their lifestyle, because we want to make sure that we're not just focusing on the supplements, we are focusing on whole person health. Again, nobody wants to jeopardize their health. I could come into your pharmacy asking for an immune supplement. Meanwhile, I didn't sleep all night. And if you ask me one or two questions, you'll be able to realize that my problem was actually sleep. And I look at it this way. When I'm assessing individuals and I'm looking at the specific needs that my patients have, I use 4 pillars. If you're able to write this down, this might help you in personalizing protocols for your patients. But what I do is I talk about nutrition as I look at a pillar, consider like a table with 4 legs, like the pillars of intentional living that I coined. Nutrition is number 1. Number 2 is physical activity. Number 3 is inner alignment. And inner alignment, I consider restorative sleep, all the rest, biomarkers, and just mindfulness, journaling, and just general lifestyle in that. And then the last one is positive social connections. I put all that together and I pick out one thing from this that can help, in addition to, as the name supplements implies, in addition to everything else that we're doing, in addition to a healthy lifestyle, in addition to all of these, to be able to create a good recommendation for the patient. And I start with that. And once I answer that question, I want us as pharmacists not to limit ourselves, not to limit ourselves to the mechanism of action of the medication, not to limit ourselves to the mechanism of action. Because when I come into your pharmacy, I would like a recommendation, or I'm online, I want a recommendation, I want to click and make a purchase, I want to feel better. I really don't care at that point about the mechanism of action of the medication or the mechanism of action of the supplement. So do not limit yourself. Take into considerations nutrient depletions, take into considerations testing, take into considerations alcohol consumption, chronic stress, and other comorbidities of the patient. So that way we can be able to look at the whole protocol that we're going to give the patient and what will be best for this patient. And we don't want to overburden ourselves because we're already working a lot at the pharmacy. Start with yourself. With the immune support protocol that we have, my recommendation is to use what Fullscript already has. There are templates on there which I use, so that I don't have to go back and create the whole thing again. I know that there are standard immune support protocols that have already these supplements put on there for me. The whole person health, I'm going to go one step further here. I think I talked about that already. Okay, this is the evidence-based ingredients that I'm looking for. So if you see these cross with the foundational supplements that I put initially, vitamin C, 3 to 4 grams daily. You're going to be giving this to patients, and you're knowing that this has little to no drug interactions anywhere for patients. The American ginseng, those would have some drug interactions as well as echinacea, but zinc, you're safe with that. Probiotics, you don't want to forget about that. We don't want to forget about the probiotics because we want to make sure that we are making sure that their gut health is important. I start with myself when I make these recommendations. I ensure that I am taking these supplements. I take these supplements to make sure that my health is up to date. If you cannot sell something, you cannot advocate for something, and you cannot educate about something if you do not believe in it wholeheartedly. So my goal is that you believe in this and you take these supplements for yourself. After yourself, you go to your team, my pharmacy team. What I do for my pharmacy team is that I order a wholesale for my pharmacy supplements and I put in the pharmacy. The foundational supplements are there at the pharmacy. If you do not, I make sure that everybody has enough supply. Instead of giving them a lunch as a reward, or as you would, maybe buy lunch for your team members, during the cold and flu season, what I typically do is as soon as we get the flu shots, sent to the pharmacy, I would order immune supplements and give to everybody in the staff. And this is a gift from me to you because you're on my team, because I would like you to be healthy. I need you to be healthy so that we can work together and go through this season. This is going to be a hectic season for us, but we cannot afford to lose one of our team members to ill health during this period. So taking care of your team, taking care of yourself first and your team second, those rewards. It's not just the buy-in, but then also the psychological effect that I'm cared for, I'm loved, I'm appreciated. That actually augments, the team effort for everybody. And then the team, if they're taking the supplements now, they can even make better recommendations to the patients. And we use the QR code, stepping on from yourself and then your team now to the patients. I look at myself as the pharmacist. I take care of the team, and then the team can take care of the patients with under my auspices. As well, I use the templates and the protocols that are on Fullscript. Our strategic onboarder at Fullscript created the easiest thing that we could use. It's just the QR codes, which makes life so much easier, so that way we can just give it out to patients, and patients can and just create their profile immediately, and that's the basic information they add in, and then they make their purchase right away. They make their purchase, and then they can make subsequent purchases. Add it to the plan, and then add your patients using those QR codes. The basics stay the same. These recommendations don't change. The foundational supplements stay the same. The pharmacy supply is one thing that I also use. I keep an open bottle at the pharmacy of most of my immune supplements. Keeping that open supply, like I said before, so that if somebody forgets to take their supplement that I gave to them at home, they can take it when they come in. Also, so that some patients like to see the pill size. Some patients would like to see that. Taking, for example, probiotics, one thing that has worked well for me, I found a kit probiotic on Fullscript that I love so much. I purchased, put one at the pharmacy, and I actually open it for the patients to try and give the children to try. They chew it, they love it. It has 5 billion colony forming units. It's the evidence-based, supplement for immune support. And because the children like it, it comes in different flavors. And then the parents actually purchase it. And I just give them the link. They can purchase it on Fullscript and then they can be able to they can send the link to their friends. They can purchase it actually for themselves as well. And so with that, it really helps everybody and makes my life so much easier. It reduces my shipping costs at the pharmacy, so I don't have to be shipping. It reduces my work, and so I don't have to be working at all because all the work is done already on Fullscript. So I just want to encourage you with all my might to take advantage of your strategic onboarders, because they would do the work for you like mine has done for me. And if you have any questions, just reach out to them. And I don't know, Sarah, do we have any questions as we are on? Do we have any questions?
Yeah, we got a few, but just a reminder, if you have any, please drop them in the Q&A or chat box, and we'll be sure to get to them because we have some extra time now for a Q&A with Emla. So the first question is, could you share how to approach a conversation with patients who might be skeptical about the efficacy of supplements in regards to immune support?
Wait, say that one more time, please.
Yeah. Could you share how to approach conversations with patients who are skeptical about the efficacy of supplements for immune support?
Okay, so here's what I like that question, because there's always times that we encounter those patients. And when we look at that, I always step back and I don't take it personal, because the first thing is that if I take it personal, I might come across to the patient as maybe offensive or defensive. So the first thing I take is that, there are also patients who don't believe in vaccines as well. And I'm administering vaccines. And there are patients who are like, oh, their parents have told them or their friends have told them, oh, supplements are a waste of money or they're just expensive pee. I use myself as an example. I am at the pharmacy. I'm exposed to a lot of patients. People are coughing in my face, talking in my face all the time, strep, flu, all the upper respiratory tract infections. But I look at it and I equate it to food. In my house, we put in effort to eat a nutrient-dense meal. We put in effort to put phytonutrients on our plate. We put in effort to eat healthy, because we're hoping that is going to help us lead a healthy lifestyle. That's going to help us be healthy. It is not always 100%. Medications we take, food we eat, supplements we take. We are hoping that these are going to help us, give us one step closer to our health journey, one step closer to the healthy lifestyle that we want to live. So even if the supplements are 100% effective, 90% effective, or 70% effective, to me, it is better than nothing. And I use myself again as an example. In my body, I would take, for example, just zinc. If I'm talking to you right now, Sarah, and you have the flu, what's going to happen is that I'm going to inhale some of those viral particles. I'll inhale some of those viruses. And when I inhale some of those viruses or bacteria for any upper respiratory tract infection that you have, they have to go in my body, they have to replicate and then infect me. But if I have high levels of zinc, if I have high levels of vitamin C, if I have high levels of these antioxidants, I consider antioxidants as ultra cleaners that clean up the house, clean up the free radicals and throw them away. So if your house is a little cleaner, if your house has less free radicals, you have a higher chance of suppressing this viral replication so that those viruses don't replicate, those bacteria don't replicate and infect you. So it's about chances, it's about probability. So doing something that will take us closer to health than away from health. And if the supplement doesn't hurt me, it's probably going to help me take me closer to health, because it's going to help those antioxidants in my body clean up house. I know that was a little long-winded, but that's kind of how I approach it from different angles. Does that make any sense, Sarah?
I was going to say that was beautifully said. I think it was a really good explanation.
Yes, because I wish we all had a wonderful answer. Like, if you take this, you're going to be healthy and you're going to live forever. Everything is a chance. Everything is a probability. And nobody wants to jeopardize their health. If I'm taking metformin, there's no 100% guarantee that the metformin is going to cure my diabetes. There's a chance that it's going to reduce, my A1C, is going to reduce my fasting blood sugars, it's going to help me. But anything, small, consistent steps in the direction of our health. And that's how I look at it with patients who are hesitant. And you say it, you state it, use yourself as an example, and then be done. And don't stress about it, okay? And enjoy your job. Know that you've done the best for yourself and your patient that day.
I think that's great advice, Emla.
Thank you.
The next question is, because price is a barrier for most patients, how can I educate them on the benefits of purchasing through my pharmacy or Fullscript versus Amazon or Walmart?
Okay, when I look at, I always say, there's Amazon and there's Walmart. There's Amazon, you can purchase on Amazon. And once you purchase on Amazon, the chances that they're kept, there's in a warehouse there somewhere, the storage conditions, there is a study that I had read that, showed that the people who did the study, they bought supplements from, Walmart, a bunch of other pharmacies around and Amazon, and they did a third-party testing on these studies, and they found, just to find the active ingredient, if what's actually labeled on the bottle is what it is, some of them, because they've degraded, they've been stored at conditions that you and I don't know where they've stored them. If I'm putting something into my body, it is my body. I don't want to jeopardize it. I want to make sure that I'm getting it from a reputable source. And I trust my pharmacist and I trust Fullscript to give me a supplement that has been stored at the right conditions, that was produced by a company that is third-party testing their supplements, that takes efficacy and quality control as top-notch. And that's how I look at it. I say, you know what? It is my body. If it is something that I'm going to be, putting out there, I could, minimize on it. If it's going on my skin and if it's going into my body and on the skin of my children and into my kids' body, I'm going to make sure that I'm purchasing the best that I can. I'm putting in, that's why I work hard so I can be able to afford. It might be a little bit better. I always take the example of iron, okay? Real quick example. When a patient comes in and says, oh, the doctor said I need to take iron. They gave me ferrous sulfate. You can buy ferrous sulfate on Amazon for $4.99. You're going to take it. You're going to have constipation, okay? And then your tummy is going to hurt. Who wants to eat chalk and have a tummy hurt? And then 80% of people who start taking iron, they discontinue it because of the constipation, because you spend $4 on it. Meanwhile, you could have clicked on Fullscript and bought a better salt form of iron, maybe a ferrous bisglycinate on there, for maybe $10. You spend $6 extra or $12 extra. That's money you could have spent on a hamburger or anything, or a nice meal out there for an ice cream, and then you don't get the constipation, and then your ferritin levels and your total iron binding capacity actually increases. To me, it's, do you want to get the benefit now, or do you want to get the benefit later? And the benefit now, you're sacrificing your health in the future. So it's really about putting it into perspective, and it's just preaching and reemphasizing, and hopefully one day they get it. And but also resting assured that as a pharmacist, you have done your best, because when I come back home, I know that, today, Sarah, I did my best educating the patients that I had. Do we have time for any more questions?
We do, yes, definitely.
Yes.
The next question is, what are the top immune support supplements that you would recommend keeping on hand for your staff? I know you mentioned this a bit earlier, but are there any favorites that you would recommend?
Okay, so my personal favorites are, I love the autoimmune, which contains the top supplements that don't have many drug interactions. So that contains vitamin C, vitamin D, zinc, and acetylcysteine quercetin. So that's autoimmune, and that's on Fullscript. I have that favorited on my store. And also, I love the Vera seed as well. That has the herbals as well. So, and I would actually give patients both sometimes, depending on the complaints that they have. And I'm open and have my email on it to answer additional questions. I also love Daily Immune. I think that's also a favorite on my store, Daily Immune. Am I allowed to say the supplement, the company names? Okay, yeah. So Daily Immune is pure encapsulations. Autoimmune is orthomolecular products. And then there is, there's forgotten the one by Metagenics, but these are my top two because I keep autoimmune for my staff. So I buy enough autoimmune. I actually just purchase it whole on Amazon. I just get enough to sustain my entire staff throughout fall and winter. And that is my gift to them so that we stay healthy at the pharmacy, and we have an open bottle at the pharmacy in case you forgot to get yours that day. And then I also have some vitamin C on hand, and I have some zinc lozenges. I think zinc lozenges, I get the Douglas Labs on Fullscript. So I just keep those on hand so we can just suck on them if somebody's coughing around the pharmacy nonstop.
Wonderful. I love that. You're reminding me that I need to stock up on all of my immune support essentials.
Please do. We need to have them. We can't be messing around. Nobody has time to hang around with sick people. I want healthy people on my team.
I agree with that. That's a good message. It looks like those are all of the questions for today. So if there were any final key takeaways that you wanted to share, Emla, I will open the floor to you. But I just wanted to, one, on behalf of Fullscript, thank everybody for joining today. As a reminder, we will share this recording, and I wanted to thank you for your wonderful presentation and being here with us.
Well, thank you very much, Sarah. I really appreciate you for having me. And my hope and goal is that every pharmacist takes the opportunity. And what Fullscript has done, Fullscript has made my life so much easier as a pharmacist, and my work as an integrative pharmacist and a preventive pharmacist very easy, because I don't have to be creating these protocols over and over. They're already created for me. I like the easy life. Get out there, send a protocol. These things don't change. The foundational supplements don't change. The number of my children will always take a probiotic that has 5 billion colony forming units. That's going to stay the same forever. Click on Fullscript, order, ship. Click, order, ship, and that's it. My life is easy. I don't have to do anything about packaging. I don't have to incur the postal services and all that stuff. It's moved on to the patients, and then the patients come to me for the clinical knowledge, which I can offer to them. And then it's a win-win-win for everybody. So, health-wise, revenue-wise, and then clinical knowledge, we're practicing at the top of our licenses as pharmacists in the space. So very happy that pharmacists are getting on board and taking the supplements themselves, taking care of their teams, and taking care of their patients. And I appreciate the opportunity to partner with Fullscript to encourage pharmacists to practice at the top of their licenses and practice whole person health.
Wonderful. Thank you so much again. Have a good day, everybody.
Wonderful. Bye-bye. Thanks for having me.